toolkit. So everyone here brushes their teeth every day, right? Yes. Okay, I'm glad to hear that. But brushing is not enough to ensure you have a healthy mouth. Not always, because some of the things we do and the products we use every day could actually do more harm than good. Here with a quiz to determine how healthy your mouth really is, please welcome dentist Dr. Gerry Curatola. Hi, Gerry. Okay, I think a lot of people don't realize how important oral health is to our overall health. Tell us about that.
Well, you know, we know now that the health of your mouth plays a very big role in your ability to live a longer, healthier life. So if you have gum disease, for example, you have up to a 10 times greater chance of a heart attack or stroke.
So it's critically important not just to obviously have a nice smile and good breath, but for your overall health. So we have a quiz. Our audience has true, false paddles. So let's get started. We're playing How Healthy is Your Mouth? And the first question is, brushing more frequently keeps your mouth healthier, true or false? True. Okay, I'm going to be counterintuitive and say false.
You are correct.
I am?
You are correct.
Oh, sorry, I am correct. You're not. I'm
There's
kidding. Some of you are. Okay,
I think we have a lot of obsessive compulsives out there, but who brush all the time. Believe it or not, excessive brushing can actually wear tooth enamel and also cause gum recession. And what you want to think of it is you're not scrubbing the kitchen floor, you're really sweeping gently. We recommend twice a day, 3 times if you're in the middle of the day, but people who brush constantly, we actually see enamel being worn away.
Okay, so don't do that. All right, true, false. If you have a choice of brushing or flossing, you should always brush. True or false?
That's absolutely right. It is false. Flossing is more important than brushing. The reason is, if you think of it like this, brushing is if you have row houses, which your teeth are a bunch in a row. The front of the house, you're cleaning the front lawn, you're cleaning the backyard, but where do villains lurk? They lurk in the alleys between the teeth.
Okay.
So flossing removes harmful bacteria that actually is where a lot of cavities and gum problems start, what we call interproximally between the teeth.
All right, here's our next question. You should always keep your toothbrush in the medicine cabinet. True or false?
False. Okay.
The answer is...
True.
I know why, too, and it's kind of disgusting. I'm not going to lie. Gerry, tell us.
Your bathroom, and it always amazes me, you know, they make those ceramic toothbrush holders. Well, when you flush your toilet, you contaminate a 6-foot radius around your bathroom with everything from E. coli, bacteria, viruses, mold, and everything else. So really keeping your toothbrush not only in the bathroom cabinet, but covered.
Right.
And toothbrush covers, plastic toothbrush covers are really not good because they act like little petri dishes that breed bacteria. So I favor there's a toothbrush shield, a thin fabric cover that whisks away moisture and saliva and protects and it's a 99.9% virus and bacteria barrier.
Okay. Mouthwash containing alcohol can be hazardous to your oral health. True or false?
It's a smart audience. Who said
True.
It is true. Alcohol-based mouthwashes, which are starting to go, you're starting to see more alcohol-free, and the reason for that is, what we know is that alcohol is very drying, and it can disturb the natural ecology of the mouth, called the oral microbiome. Billions of bacteria in your mouth that are part of your body that protect you and actually keep you alive.
So good bacteria, like you shouldn't use too much hand sanitizer because it gets rid of the good bacteria as well.
Exactly.
So
the story with alcohol-based mouthwashes are they denature some of these cells in the mouth, and it actually disturbs the bacterial balance. And there have been studies that are showing a link between alcohol and mouthwash and some types of oral cancer.
All right, so if you just found out you're doing it all wrong, not to fear, we're going to tell you how to floss, brush, and rinse the right way. That's right after this. Welcome back. So we all just tested our know-how on oral health. It turns out some of us could use a few lessons. Dr. Gerry Curatola is going to tell us the dentist secrets to getting a healthy, beautiful smile at home. Okay, there's so many types of dental floss.
Right.
Which is the best one?
It really depends on the situation in the mouth. I mean, unwaxed is what's been around a long time. Ribbon floss is a little bit thicker, so if you have big spaces between your teeth, it's really nice because it splays out and it's more efficient in removing debris when you have a large space. Waxed floss, for people where the teeth, the contacts are very tight, it helps the floss slide between the teeth easier.
And mint if you just don't like flossing.
Exactly, if you're grossed out by the whole process.
Meanwhile, these are also really handy, and these are usually good for
Older patients, people who have trouble manipulating or may have disability holding things and getting them inside your mouth, these can be effective. Floss holders, and if you have teeth like bridge work and things like that where teeth are connected, these are good for getting between.
What are these
These
called?
are floss picks.
Floss picks. Okay, tell us real quickly, if you can, how to properly floss.
Okay, most people try to.
Whoops. You need
They
a bigger
try to
piece
take
than
a
that.
piece this big.
Yeah. Okay, there
You really
go.
need 18 inches.
18 inches, okay.
And then what you do is you take it off here and you wrap it around your index finger very quickly, just like that. And you do not snap it up between the teeth. We're going to take these teeth. They look like Shaquille O'Neal's, size 18 shoe.
Okay.
Okay. And you go between the teeth, and you have to think of the floss as a lasso. So you don't just snap it to the gum and magically, you know, that does it. You really want to go against the side of the adjacent teeth on one side and the other side like a lasso, and then simply remove. Or you can simply pull through.
Okay, all right, let's talk about toothbrush, because I always buy soft bristles. Is that the best kind?
Absolutely. A soft brush, really at a 45-degree angle, so it's gentle back and forth, and actually it would be this way. I was from the back of the mouth. Back and forth gently and sweep down. You may want to hold it the way you would a pencil. It helps you scrub, for those who are really hard scrubbing, holding it like a pencil instead of a handle is also effective.
That's
That's why
interesting.
they have these rubber grips now. These rubber grips are really good for having you not be so harsh. It's just really removing debris and surface plaque that forms every 24 hours.
Okay, now tongue scrapers, which totally gross me out, but they're really beneficial, right?
Super beneficial. 80% of the bacteria that cause bad breath are on the surface of the tongue. And what we found is brushing gets some of it off, it doesn't all of it.
And it kind of moves it around.
These are really effective. I'm not going to do it here to gross everybody out,
thank
but
you.
you just basically scrape your tongue once.
And you do it once a day?
Yeah, there's a few different types. Once a day is enough.
Okay, let's talk about mouthwash. What should we look for? Alcohol-free?
Alcohol-free, and if you see all these bright colors, that's not natural.
The clearer, the better.
Absolutely. Your mouth is very absorptive. So things you put in your mouth that are not natural get absorbed into your system. By the way, 1 American dies every hour, every day, from oral cancer.
Which means your oral health is really important. And when you go, by the way, to get a checkup, make sure your hygienist or your dentist examines your mouth and tongue, because oftentimes they're the first people to see when there's a dangerous sign going on.
Absolutely. Under the floor of the mouth. Thank you, Katie.
All right. Good point, right?
Absolutely.
Thank
Very
you, Gerry.
good point.
All right, thank you
Gotta
so
get to the-
much. I'm going to go home and do all these things the right way, and I'm going to floss tonight. Once a day or twice a day?
Well, once a day is enough. Bacterial plaque.
Okay, oh
forms
my
once
God,
every
once a
24
day,
hours.
once a day, once a day. All right, we'll be right back.